Many of us are learning new ways technology can help us work remotely during a pandemic, and so too are health professionals. Now more than ever, virtual healthcare is getting a major push forward, but according to one expert in Canada, there's still a long way to go. Through TikTok, and at some hospitals, remotely accessible test results. During the COVID-19 pandemic, healthcare professionals are using technology to communicate with the public and patients remotely, a vitally important tool as all of us around the globe are being told to stay home and to practice social distancing. It's all part of the larger umbrella of virtual healthcare and something more doctors want to see employed to protect patients and frontline staff.
We've seen, even in this COVID pandemic, people who are healthcare workers who have had medical conditions dying as a result of taking care of patients.
Dr. Sasha Bhatia says the ability to see a large portion of his cardiac patients remotely has been instrumental in minimizing their exposure to the virus. But he adds that Ontario has made major steps towards supporting virtual care, including recently opening up the rules in billing, letting doctors bill for virtual visits more similarly to how they would bill for in-person.
So combine the absolute need of the pandemic with changes in the billing codes has meant I think you've started to see a revolution happen in Canada around virtual care. And I'm not sure, to be honest, that's going to change.
But the need to address immediate concerns has pushed healthcare systems across the country forward in even more ways. To help reduce the volume at assessment centres and filter out those who don't need to be there, many provinces, including Ontario, have launched online self-assessment tools, interactive questionnaires that give you advice and next steps based on a set of criteria. Bhatia believes at this point other countries are still far ahead of us in taking full advantage of virtual care, but technology is quickly responding to the needs of the healthcare system.
In Korea and in some of the Asian countries, they used WhatsApp text message to be able to message people with COVID-19 who are positive. I don't think we're doing that as much as we could. I think we've seen our whole society change in response to this pandemic. So nothing would surprise me at this point in time. The future is sooner than we think.
In Toronto, Natividad, CityNews.